Hi, my name is Mitch Roob. I'm the president of Healthcare Anywhere, and we designed this telehealth platform for providers and their patients so that you as a provider can maximize the compassionate care that you provide to your patient population. What you see on the screen now is a brief review of our product in action, helping providers connect directly to their patients. There are really three groups of stakeholders that need to be satisfied: patients, physicians, and payers. The value proposition of this product is pretty straightforward. Convenience equals compliance. Convenience for patients, allowing them to see their providers whenever, more importantly, wherever they happen to be located, as long as they can get an internet connection, equates to compliance on their part. Increased physician income, decreased length of time for each of those appointments, and for payers, it means that the patients are receiving the kind of quality care they need to thrive. We've built this technology on a modular platform with video, calendaring ability, scheduling, payment portal. Obviously, it is secure both financially and from a HIPAA perspective. We can move files into the product and we can export into the electronic medical record if the provider group so desires. We're not like Skype, where those of you who aren't involved in healthcare, you can see the difference here in this picture. This is a picture of me on Skype and then on our product. Because we use WebRTC technology, our picture is cleaner. In addition to that, we provide secure video messaging, PCI compliant payment portal, patient scheduling. We're HIPAA compliant. Together, this makes us a far superior product than Skype. We've built a team, and that team is made up of healthcare professionals and technology professionals with dozens of years of service. We can go into that in more detail in the future if you're interested. The market size for telemedicine is large and growing rapidly. Today, it's about $27 billion. Over the next 4 to 5 years, that's expected to grow to about $58 to $60 billion. Most importantly, patients love telehealth. They're willing to see their providers using products like this on an ever-increasing basis. The adoption of telehealth is still relatively nascent, and there are three reasons why we believe we will find an enormous increase in the likelihood that telehealth as an industry really takes off. The first is the availability of mobile devices and cameras and the access to 2, 3, and 4G networks. 11 years ago, when I was running Medicaid in Indiana, we started doing telehealth, telepsychiatry actually. And it cost $30,000 to set up one physical location before we even saw the first patient. Today, virtually every provider and virtually every patient have the technology in their hands necessary to do telehealth. Combined with the ubiquity of bandwidth that's available in providers' offices, in homes, and places of work. And secondly, the technology upgrades that were resulted after the passage of the High-Tech Act in 2009 means that physician offices have new technology that is cutting edge. And in addition to that, the physicians, their nurses, and other providers have become conversant in technology in a way that they weren't in the past. And thirdly, a decision by the Centers for Medicaid and Medicare Services and other large insurers to actually reimburse for a broad swath of telemedicine services. These things make explosive growth for telehealth possible. Today, we're focused on several different verticals, so let me just touch on a couple of those. One is behavioral health, and broadly speaking, that includes PTSD, weight loss, psychiatric care such as depression, addiction care. In addition to that, we lump cardiological care into that area because really the cardiologist is focused on helping that patient to change their diet and exercise to maintain the quality and quantity of their lives. And then we're also focused on hospital systems, particularly rural health care and readmittance. Telehealth is a product that can certainly expand the capability of hospital systems, particularly those that are taking risk now as ACOs, to decrease their readmission rate and save tens of millions of dollars. We're not the only one in the marketplace today doing telemedicine, but we are a third generation telehealth product. First generation was really a provider to provider relationship. In our case, the mental health care provider ran a T1 line 60 miles south to a community that didn't have psychiatric care and provided it primary care physician's office. That kind of telehealth still goes on and is still very valuable. You can use our product and many other products if you wanted to in that format. The second piece is what I'll call the teledoc option, and that is where a company builds technology and hires dozens and dozens of healthcare providers, physicians, that staff a call center and allow that particular patient to contact a physician using a telehealth platform. Problem here, of course, is that particular patient is unlikely to have ever heard or know that individual provider provider, nor will that provider have any background information on that individual patient. This complicates the relationship and in some states makes it illegal for that provider to actually write a script. The third incarnation of telehealth is the one that we provide, where we directly connect a patient to his or her provider using our network. That's why we believe our model is superior. In addition to that, from an investor's perspective, it means that we are not taking any of the liability that necessitates malpractice insurance. This year, we're focused at HCA on growing our sales and marketing staff. That includes the development of reimbursement specialists. We've installed several of our initial clients and are getting great reviews at this point in time. We'll also be further modularizing our product and putting an e-prescribe capability into that product later this year. My name again is Mitch Roob. I'm the president of Healthcare Anywhere, and you can contact me at this email address, and that's my cell phone number, 317-460-5819. Thanks so much for your time.